Hi, today we are looking at the tongue of a 62-year-old female. This person is not my patient and we know very little about her medical history, but we do know that she has had chronic digestive problems since childhood. She also has a heart defect that cannot be repaired. She is under a lot of stress and has emotional issues which make her feel tired. Now, let's see what her tongue would tell us. The first thing that catches the eye is the pale, swollen body. It clearly indicates a deficiency in both the lung and spleen qi, the vital energy responsible for transforming and transporting fluids and nutrients. A tongue is pale because yang qi is too weak to transport sufficient blood to the tongue. Pale and swollen tongues are often accompanied by teeth marks, like in this case. The deeper and more distinctive the marks, the more serious the weakness of the stomach and spleen qi. Spleen qi relies on kidney yang for support. Noticeable teeth marks, scalloping edges of this swollen tongue further emphasize a weakened spleen qi struggling to manage dampness. This isn't a recent development. The deepness of these indentations hints at a chronic issue, likely contributing to the GI problems from childhood that the patient described. The spleen in Chinese medicine is the cornerstone of digestion, and its weakness allows dampness to accumulate, puffing up the tongue's body. Next, we can observe how the root is contracted and depressed. This is a sign pointing directly to kidney qi deficiency. The kidneys are the root of all qi in the body's fundamental reservoir of energy. A depressed root suggests a depletion of this foundational energy, likely contributing to the patient's persistent fatigue. Kidney qi is the sum of kidney yin and yang. We have already noticed that kidney yang is weak. Now we begin to suspect kidney yin depletion as well. The indented tip of the tongue adds another layer to the narrative, specifically highlighting the heart, blood, and possibly yin deficiency. The heart in Chinese medicine governs the blood and houses the shen, which can be translated as mind or spirit. An indented tip suggests insufficient blood nourishing heart, potentially linking her stress and emotional issues and further contributing to the feeling of being tired. Next, we can observe a thick white coating that blankets the tongue, a visual manifestation of accumulated phlegm. This is often a consequence of the spleen's inability to transform fluids properly due to its qi deficiency. The dampness, which cannot be processed, congeals into phlegm. We cannot tell from the tongue coating alone the exact location of phlegm. It could manifest in the lungs, in the digestive issues, or it can obstruct the circulation of blood. Given her heart defect, which cannot be repaired, this sign takes on even greater significance, underscoring the energetic strain on the heart and the lungs. Despite the dampness suggested by the tongue coating and swelling, the tongue presents as slightly dry. This seemingly contradictory sign hints at kidney qi deficiency, particularly affecting kidney yin, the moistening aspect, which means that despite dampness, the body lacks the fluids to properly nourish and moisten the tongue. The source qi, reliant on the harmonious interplay of kidney yin and yang, is clearly struggling. Further down, we can observe the anterior third and center of the tongue, noting it is swollen, dry, and cracked. This pattern strongly suggests a blockage of lung qi due to the accumulation of dampness, hindering the proper flow of fluids. The dryness and cracks in this area also point towards the onset of lung yin deficiency, where the lungs are becoming depleted of the moistening and cooling energy. We keep in mind that the lung yin depends on stomach and kidney yin. Finally, the purple sublingual veins offer a glimpse into blood stasis. While the exact location of this stagnation remains unclear from this single sign, it indicates a sluggishness in the blood flow, potentially contributing to heart issues. What we can be sure of is that there is an interplay between phlegm accumulation, Qi deficiency, and blood stasis issue, because Qi moves blood and phlegm obstructs the movement of blood. Putting it all together, we can see kidney Qi deficiency that results in spleen and lung Qi deficiency and the accumulation of dampness and phlegm. On the other hand, we can observe kidney yin and heart blood deficiency. These are also interrelated, as yin and blood mutually support each other. Finally, Qi deficiency and the accumulation of phlegm contribute to the stagnation of blood. To create a treatment plan, we need to know more about this person's symptoms and medical history, because tongue diagnosis allows us to gain insights into the individual's energetic present condition and inform us of energetic past. Therefore, each listed sign on the tongue may be of primary or secondary importance. This is all I have for you for today. Thank you for listening. Stay healthy, and I will see you next time.